Medical experts are warning people to take extra precaution this winter.
The State Department of Health says Mississippi is reporting nearly double the number of flu cases as it did this time last year, many cases severe. And as 12 News' Brandon Rains tells us, doctors say it's more crucial than ever to get vaccinated. Brandon?
Yes, you especially want to make sure to get that flu shot this year. Both flu and coronavirus cases on the rise.
Certainly that can lead to increased illnesses, increased severe disease, hospitalizations, and unfortunately increased deaths.
The State Department of Health reports 400 new COVID-19 cases and 1,100 new flu cases in just the last week.
A number of weeks, we're still seeing very high flu activity in the state. And really, we're starting to see that throughout the United States now.
Doctors say they are seeing a 10-year high for flu cases, but they say the flu shot can lessen the severity.
Every year, it's kind of a hit or miss whether or not the flu shot matches with the flu that circulates in the community. This year, it's a good match.
While COVID-19 numbers aren't as high, state health leaders say they expect numbers to rise during the holidays. They say now is the time to get your updated booster.
Many people in the state have been fully vaccinated against COVID, and that's important. But a vaccine that you got months and months or even a year ago is not going to necessarily provide you with the adequate protection you need.
Already understaffed hospitals are struggling to make room for the growing number of patients.
It's yet another problem that all of our hospitals are having to deal with, and specifically our rural hospitals are under significant strain, mainly because of inability to transfer easily, which is how, our healthcare system is made to work, is to get the person the right level of care based on their needs. The hospitals currently are still severely understaffed, and these are all direct results from COVID that have not gone away.
The state health department also says if you're feeling sick, to get tested and stay at home. Doctors predict COVID and flu cases will decline in the spring, but there typically is a second wave of flu infections by summer.